Welcome to Adaptation class. Listen, if your exams is in 3 weeks or tomorrow, this 85 question right here is what is standing between you and the passing results. Don't skip, don't fast forward because one of these questions will show up. I've included a new test plan. Some of the questions they highlighted, they will be including. I want you to take a pen and paper, keep track of your record and see how you do because this is most likely mixed questions. But put it together to include the new test plan. Are you ready? 85 question. Achieve over 65. Let's go. First question. As usual, prioritization. But what? In the form of multiple patient prioritization. That's what the new test plan was emphasizing. Place the following client in the order the nurse should assess them from the highest to the lowest. You know them. Don't worry. It's in the form of what? Arrangement. Just consider them as if there's no arrangement and answer the question the way you would do usually. A nurse is caring for 5 clients on the medical surgical unit who have various respiratory conditions. 1, asthma, is wheezing, is using accessory muscle, saturation is 91%. 2, COPD patient, productive cough, heart rate of 96. 3, pulmonary embolism, chest pain, heart rate of 105. 4, pneumonia, cough, fever, and crackles. 5, pneumothorax, tracheal deviation, no breath sound. Who do you want to see first? Second, third, fourth, fifth. Multiple patient prioritization. New NCLEX test plan, 2026. Are you ready? Can you answer this question? I believe in you because you watch Adaptation class. Let's get this done. You pick your answer? Arrange them the way you want to. I know you get it right. Who do you want to see first? Well, they all have respiratory problems. So you can say it's a breathing problem, it's an airway. Now you got to consider which airway issue is bad or which breathing. Remember, respiratory can have airway and a breathing issue. If it affects the tubes that bring oxygen into the lung, that's an airway. So you got to know the difference. Thus, anything that affects this tube is airway. Anything that affects the lung itself is breathing. Therefore, which one? Which one is the most important? I can tell you, pneumothorax tracheal deviation is affecting the tube, and this is tension pneumothorax. That's the first patient you see. Followed by what? Pulmonary embolism. This patient is going to have compromised respiratory status. An asthma patient using accessory muscle will follow third. Second one is more dangerous than an asthma patient using accessory muscle. This patient, no oxygen going through the lung because of what? Blockage of the arterial blood supply. Followed by a pneumonia patient who is coughing, he has fever, sepsis, crackles. COPD patient, productive cough, heart rate is fine. That will be the last patient you see. But this is the hardest respiratory prioritization you want to see in a question. But pay attention to the way I approach them. You have to know the pathophysiology to answer them. So this is your right answer. 2, this is what? Physiological adaptation, cardiology. I will show you each question, where it's coming from, so that you can pay attention and you know how to answer them because there are certain areas you need to score high, especially physiological adaptation. And then she's caring for a client who is receiving furosemide, pharmacology, in the form of physiological adaptation. Which of the following electrolyte abnormality should the nurse expect? Select or apply. Hyperkalemia, hypernatremia, hypercalcemia, hypermagnesium. What? Hyponatremia. Pharmacology question under physiological adaptation. What do you think? Stop the video, keep track of your record, and know how to put them together so that you can figure out what is your score. You have to know the function of furosemide and what does it lead in terms of electrolyte imbalance. You pick your answer? I can tell you, furosemide, the best way to remember them is loop diuretic. You loses everything. That's the way I can tell you. Loop diuretic, you loses everything. I have a good video on my channel. We talk about the pathophysiology of how furosemide lead to loop diuretic, losing everything. If you're losing everything, potassium is low. Losing everything, sodium is low. Losing everything, calcium is low. Losing everything, magnesium is low because you follow what? Potassium. Therefore, hyponatremia. This is the way you answer this kind of question. You have to know the strategy, put it together, and use your concept. NS is caring for a client with what? Intracranial pressure monitor. This is one of the clear statements that was indicated under physiological adaptation for the test plan 2026. They said you should be able to answer questions of intracranial pressure monitoring, details, and certain things. So I give you this one. Created this one for you. But if you pay attention, you'll be able to answer it. If you lose the main point, the buzzword, you're going to mix it. That's why I said English practice test question, most likely to be mixed. You separate the process from the feelings. But I know you're going to pass if you watch this video. ICP reading increases from what? 12 to 24. Which action should the nurse take? ICP monitoring device, your ICP increases from 12 to 24. What would the nurse do first? Lower the head of the bed, reposition the client's neck to the midline, suction the airway, increase IV fluid. You can be trapped by looking just the answers, but use the concept and know which one you want to pick. You pick your answer? I know you picked the right answer because the right answer is what? Number 2. When your ICP is going up, we should decrease it. How do we decrease it? Keep the head in midline. You've watched videos on, you know about it. Some of the things you should institute when the patient has high ICP or they have head injury is to keep the head midline because what? It allows drainage, venous drainage, and that decreases what? ICP. If you lower the head less than 30 to 45, ICP increases. If you suction the patient, ICP increases. If we increase fluid, ICP increases. Even if you don't know that number 2 is the right answer, pay attention to the other ones. You can see that you can eliminate. Keep the head midline, and that will decrease venous return and allow ICP to decrease. Same thing, safety question. You know it. It's in the form of prioritization and arrangement. Just pay attention to the keyword. That's all. Match each procedure with the appropriate client position after the procedure. After the other procedure, match them. And this is caring for 5 clients following various therapeutic procedure. After those procedures for therapeutic intervention, how do you position them? This is a safety question. Client after thoracentesis, client after paracentesis, client after lumbar puncture, client after cardiac catheterization, client after liver biopsy. These are English high-yield content that you have to know in terms of safety and positioning, fundamentals. What do you think? We have thoracentesis, paracentesis, lumbar puncture, cardiac catheterization, liver biopsy. We have high follow position, supine with the head flat, unaffected side lanes position, right-sided lane position, supine with the affected leg. Which one should you pair with them? The right answer, if you do thoracentesis, the affected side is damaged, so that should be up. So you lay on the what? Unaffected side. Side laying on the unaffected side. Therefore, which one? This one go here. Paracentesis, after the procedure, we can keep you upright. Therefore, high follow position. After lumbar puncture, we want to put pressure on your back. You lay supine with the head flat. Cardiac catheterization, that leg is no more moving. You have to be supine and affected leg flat. And after liver biopsy, you should lay on your right side because that's where the liver is located. This is the pairing that you need. Safety question. This is all very, very important that you should be familiar with. Number 5, and this is caring for 4 clients, prioritization. Which client should the nurse see first? Management of prioritization. A client with asthma, what is he reporting? Palpitation after bodrum. Client with what? Pneumonia is requesting pain medication. Client who is 2 days post-op with what? Low-grade fever. And a client who take carbamazepine reporting what? Experiencing runny nose. Who do you want to see? Be sharp. Use the be sharp and see who is in trouble. Not an expected finding, but you got to be sharp. Is it breathing, electrolyte shock, sepsis, airway, and neurological, and lethargy, and everything? How do you answer them? You pick your answer. Who do you think you want to see if you are the nurse taking care of them? Divide them. Asthma, palpitation, withdrawal, expected finding. Pneumonia, requesting pain. You are not dying. Pain medication, unless it's life, limb, eyesight, I don't care. Post-op day 2, low-grade fever. I don't think you have sepsis. You may have small fever. By default, carbamazepine, runny nose. What is the problem? Infection, sepsis. Carbamazepine causes agranulocytosis. If you have a runny nose, that's agranulocytosis causing infection. We have to see you. Prioritization. And this is caring for a client who is receiving phenolzine for seizure. During an oral assessment, the nurse notes what? This. Which of the following interventions should the nurse anticipate? Instruct the client to perform meticulous oral hygiene and use soft bristle toothbrush. Anticipate the prescription for folate supplementation. Anticipate a prescription for azithromycin. Anticipate a dose increase of phenytoin. Restrict vitamin C intake. Apply topical corticosteroid to the gum. Pharmacology, phenytoin. This is what you see. Is that okay? What do you think? Somebody is taking phenytoin and you see this. What do you want to do? What do you think? Make a diagnosis and see what you want to do. This is pharmacology, application, second level question. These are passing level question for the NCLEX. You pick your answer. What do you want to do? Select or apply. Don't over-select. But if I'm taking these tests, I go back and say phenytoin. Oh, if you take phenytoin, I know that it causes gingival hyperplasia. Oh, that's gingival hyperplasia. So big. This is going to bleed easily. This is what we call gingival hyperplasia. And therefore, what do you think? Soft bristle stool, a toothbrush, much better, so that we can clean easily and don't cause bleeding. What is the problem? Phenytoin decreases folate, and the decreased level of folate, that's what causes the gingival hyperplasia. Give them supplement of folate. Azithromycin is good, but in this question, there's no evidence of infection. Gingival hyperplasia is not infection. If there's evidence of infection, I tell you there's evidence of infection, we can give you azithromycin, but there's not. You should anticipate dose what? Decrease, not increase. We're not going to increase phenytoin because high level of phenytoin is what responsible for gingival hyperplasia. Vitamin C is very good for this condition, and steroid is not indicated. Only 2 answers. Over-select, you get it wrong. But know the concept, pay attention to the concept, and next time when you see it, you master it. EKG, physiological adaptation, under cardiology. Which of the following actions should the nurse take? Okay, next. A nurse is caring for a client on a tele-unit. The cardiac monitor displays this rhythm. This is what you have. Assess the client for a pulse, initiate CPR, prepare for defibrillation, prepare for synchronized cardioversion. That's your EKG. You're monitoring a client. We display this. Which of these nurse should do next? This is what you see. What is that? What kind of EKG? Read it. After you read it, then you can figure out what is wrong with the patient. Pause the video here. Try to name it. After you name it, then you know how you're going to manage it. You figure it out? I know you figure out. What are you going to do? What are you going to do? I can tell you, this is what? Ventricular fibrillation. This is classic ventricular fibrillation. It's chaotic. It's not uniform. These are all ventricular problem. There's no atrial problem. It's ventricular issue and it's chaotic. And therefore, VFIB, if this is VFIB, by default, you don't need to check pulse. They're dead, right? Initiate CPR. No, we got to defibrillate them as much as possible. They don't need synchronized cardioversion. In real world, most people will say CPR, but for the NCLEX, quick defibrillation. Why? Because you don't have the defibrillator there right away. In real life, you got to start chest compression, and when the defibrillator come, you shock them. But the NCLEX, when you see what? VFib, the next thing you should do, pick an answer for defibrillation. That's the best answer. And nurse is caring for a client with what? Intracranial pressure monitor. The nurse review the wave form display on the monitor. Like I said, these are questions that are likely to be mixed because this is the new type of question you may see on the NCLEX. This is test plan 2026 on intracranial pressure monitoring. But look, it's easy. I'll make it easy for you. When you see it next time, you won't get it wrong. So prepare for this so that when you see on the NCLEX, you will know. Which of the following findings should the nurse identify as abnormal and require intervention? Patient has ICP monitoring in the brain, monitoring the ICP, and the tracing, like you see, it's a form of EKG or tracing that you're supposed to see on the monitor. Which one tell you this is abnormal? P1 wave higher than P2, P2 wave higher than P1, ICP reading of 8, ICP waveform with 3 distinctive peaks. And this is what you see. You have P1, you have P2 and P3, and they give you the reading. P1 is arterial pressure. P2 is cerebral compliance. And P3 is aortic valve closure, because that's what the thing, that's what is monitor. You monitor all the things, you monitor arterial pressure, you monitor the compliance of the cerebral perfusion, and then you monitor the aortic valve. And these three should give you an idea. So what is your answer? If you don't know, it's fine, but I will teach you how to answer this. It's straightforward, but pick your answer. Think about it, the concept associated with ICP based on this, okay? And then ask yourself, if P1, the pressure 1 is higher than pressure 2, what does that mean? Pressure 2 wave, pressure greater than 1, and then ICP of 8, and ICP waveform with 3 distinctive peaks. I will show you. You're supposed to have 3 peaks. 1 for arterial pressure, your pressure outside higher. P2 is the pressure in the brain, telling you the compliance. If the brain pressure is too high, P2 will be greater than P1, right? The pressure in the brain is greater than pressure in the arterial, that's high ICP. And 3 is the aortic pressure. You're supposed to see 3 waves. Even if you don't know, you can eliminate a couple of them. ICP of 8 is normal, therefore don't do anything. And now you're left with ABC, ABD. Waveform with 3 distinctive peaks. You saw 3 distinctive peaks. This is test taking strategy. So maybe it's okay. They said, which one is abnormal? If your pressure in your brain is greater than the pressure of your arterial pressure, that means your brain have higher ICP. That's all. So P2 wave higher than P1, that's the pressure. If P1 is greater than P2, that's normal. That's what it's supposed to be. So the right answer is number 2. This is the way they will ask you the question. You can take a picture of it, but know that this is the ICP monitoring they want to talk about more of. And this is aware of several newborn in the nursing. Which client the nurse should see first? 1-day-old with excessive fruity saliva and inability to pass NG tube by the previous nurse. 1-day-old with what? Distended abdomen and imperforated anus. 1-day-old with a large non-tender left inguinal mass. 1-day-old with frequent non-bilious emesis and a palpable mass at the right upper quadrant. You have to know what each one of them, make a diagnosis. This is what GI question, and see who is in trouble. That's all. Who do you want to see first? Pick your answer. I can tell you, number 1 is your right answer. Why? Fruity saliva, inability to pass NG tube by the previous nurse. This is tracheoesophageal what? Fistula. This is the trachea, and the esophagus end over here. The other one go here, the lower portion to the trachea. If you put the NG tube here, it's not going to go. Then you have saliva all over. The kid is going to choke. That's why it's the right answer. A 1-day-old with this distended abdomen and imperforated anus. Yeah, it's bad. It's distended, but there's no evidence of early respiratory compromise in this patient. 1-day-old with a large non-tender left inguinal mass. That's expected. That's a hernia in the 1-day-old, expected finding. A 1-day-old with the frequent non-bilious emesis and a palpable mass at the right upper quadrant. Pyloric stenosis. All of them are bad. But the most important one is a kid with tracheoesophageal fistula because of what? Respiratory status. Who's going to have aspiration. Therefore, you got to see them first. A nurse is caring for a client who has a chest tube in place. The nurse is reviewing the drainage system. Which portion of the chest tube system prevent air from flowing back to the pleural cavity? That's all. Which one? Prevent air from going back into the pleural cavity. That means air escaping into the patient's chest. Which one? Suction control chamber, water cell chamber, collecting chamber, tubing connected to the suction. Therefore, this is the chest tube. See which one you think prevent air from going out of the tube into the patient, going backward. Is it A, B, C, D? You got to know which one is which. So pick your answer based on the description and see which one. And then we go over it. And you write down the concept. You pick your answer? I can tell you it's the water cell chamber. The water cell chamber is B. It prevents air from going back into the patient. The C is the collecting. It's just collecting information. And the A is the suction chamber. And the D is what brings in suction. But D is the water cell as air leak water cell chamber to prevent air from going back into the patient, going all the way into the patient. Therefore, master them. That's the water cell chamber. Which condition should the nurse suspect? What is the problem? 21-year-old client present to the outpatient clinic reporting fatigue, dizziness, frequent sore throat. What is going on with the patient? After you read that, every question, see if you match the first line. That's how you answer case study. The client state, I feel out of control about what? Eating sometimes, and I try to fix it afterward. After assessment, further assessment reveal what? The client eats what? Large amount of food in a very short time. Binge eating, especially when alone. The client induces vomiting, eat too much and then vomit after several times per day. The client uses what? Laxative occasionally. Tachycardia, blood pressure, hypertensive. What do you see? Dental enamel erosion because of vomiting. There's mild swelling of the parotid gland because of vomiting. If you look at the back of the hand, what? Callus on the dorsal surface of the hand. That's classic. And the mucous membrane is dry because you keep on vomiting. The BMI is 23. That's normal. I'm giving you the clue so that you can figure out what is going on. Potassium 2.9 because you're vomiting and your sodium is 134. Go over the question again. Analyze it the way I analyze it. When you're taking the NCLEX, do the same thing. You see, you know what is going on. A bunch of words, but I've summarized it as one thing. Is this anorexia? Is this binge eating disorder? Bulimia Nervosa? Major depressive disorder? What do you think? Look at the case again. Make your diagnosis. Number 10. Look at it again. Stop the video and then make your diagnosis. But I can tell you, this is not anorexia. It's bulimia because BMI is normal. Patient is tachycardia because they vomit. Anorexia usually have bradycardia. Why? Because what? They usually are more nourished and what? They are in starvation mode, so your body calm down. They have parasympathetic nervous system over control, bradycardia. In bulimia, because of vomiting, acute dehydration, sympathetic system. And therefore, this patient is bulimia. The BMI is normal. It cannot be anorexia. It cannot be major depressive disorder because it does not have all the features. And binge eating disorder, they just eat nonstop. Therefore, this is bulimia patient. And this is providing nutritional teaching to new mother about appropriate food choice for a toddler. No, toddler. This is pediatric health promotion. You got to be familiar with them. Which of the following food items should the nurse recommend to a toddler? Think about what is going to kill a toddler, or which are the things you should for safety, right? Safety question. Select all that apply. It's a form of health promotion, but it's a safety. What is the toddler you worry about? Steamed carrot cut into small pieces. Whole grapes, peanut butter spread tinily on the bread, or dog sliced into rounds, apple slices with skin intact, popcorn and peanut butter, and cottage cheese. Think about it, a toddler. What do you worry about it? That's when you see these health promotion questions, always think about it in the safety form. So what do you think? What do you think? Number 12. Pick your answer, let me know. But I can tell you, as a toddler, anything that will cause choking, we prevent it. Therefore, which one is appropriate? Steamed carrot. It's already been steamed. It can break easily. We can use it. Grapes is going to choke, right? Peanut butter spread on the bread, easy to eat. Our dog, the kid, is going to choke. Apple slice with the skin should be removed. Skin cause more problem. Popcorn, stay away from it. And the cheese, easy. That's the best one. Nutritional, less choking episode. Therefore, those are the things. And this is what you should say. Small, avoid add sticky, slippery food due to choking. And this is providing, and this is caring for a client in emergency department who has a history of what? Chronic heart failure. Which of the following findings should the nurse suspect during assessment? Select or apply. Bilateral crackles in the lung, weight lost, dependent edema, jugular vein distension, bounding peripheral pulses, fatigue with activity, risk reduction. What do you see? Chronic heart failure. Which of these would you see in a patient with the chronic heart failure? That's all. Pick your answer, stop the video, and let me know. I want you to achieve over 65 for this. Are you ready? I know you pick your right answer. The key buzzword for the question is what? Chronic heart failure. This is different from if I want you to worry about right-sided, I will say right. If I say left, I will say left. When I say chronic, I mean left and right. Therefore, look for signs and symptoms of left and right. Bilateral crackles associated with what? Left. Weight lost, you're supposed to have weight gain. Dependent edema is right side. Jugular vein, watch for this, flattening is supposed to be distended. Therefore, this is not expected. Peripheral pulses is going to get weak because your cardiac output decrease. Therefore, this is not expected. And it will get activity intolerance. Therefore, they are fatigued with activity. Therefore, which one should you expect? Crackles, dependent edema, and fatigue with activity. Those are the things you see in a chronic heart failure. And this is caring for a client on mechanical ventilation, respiratory question with risk reduction and physiological adaptation. High pressure alarm has sounded. Arrange the following steps in order for the nurse to take. If you see this, notify the air care provider, check ventilating setting, assess for respiratory distress, suction the patient if needed, check for tube displacement or kink. You taking care of the patient, you hear high pressure alarm, what would you do? Arrange the steps that you would take in order to prevent harm for the patient. Pause, answer the question. But this is the way it should be. We got to assess the respiratory status, right? Then we got to check what? The tubing for kink. Then we check the ventilator. And we suction the patient and make sure. And then we notify the air care provider. Why? Because high pressure alarm has to be an obstruction. And therefore, assess the patient, check what is causing obstruction, check the ventilator setting for accuracy, then suction the patient, maybe just suctioning you need, and then notify the air care provider. Because this is obstructive things that will cause high pressure alarm. Number 15, dose calculation. If you need help, check Adaptation class. But these questions, if you know how to answer them, you get the point. It's a pharmacology question and you go away. A nurse is caring for a client who's at sepsis, and they weigh what? 70 kilos. The provider prescribed what? 10 microgram of per kilo per milli of what? Dopamine. The pharmacy dispense dopamine of 400 milligram in 250 ml of 5% dextrose, a bunch of words, don't worry. At what rate, ml per hour, should the nurse set the pump? You got to calculate and put your answer. How do you approach this? Just relax. First, they give you, this is the dose. The prescribed dose is what? They say is what? 10 microgram per kilo per minute over 1. Therefore, patient weight 70 kilos, we multiply by 70. So 70 kilos. So kilo cancel. Now we have what? 700 microgram per minute. That's what? The prescribed dose. What is the available dose? Available dose is in 400 milligram, no microgram, of 250. Therefore, the 400, I got to turn into micrograms. So this over 1 times what? 100,000 microgram over what? 1 milligram. Therefore, this is gone. But this is in what? 250 ml. So 1 over 250 ml. If you calculate what this is going to give you, what do you think? So 400 times 100,000 over 250. That's all. That's what you're looking for. And this will give you 1,600 microgram per ml. Now, these two, we want to answer is in ml per hour. Therefore, I will take 1,600 first and I'll flip it. Therefore, if I want the ml to be on top, I'll put ml over 1,600 microgram. Then I'll multiply it by the 700 microgram per minute. What is the problem? They want hour. So I'll multiply by 60 minutes over 1 hour. This is what is going to give you answer. If you calculate, you get 26 ml per hour. Stop the video. Look at the way I approach it. This is dose calculation. First, you need to calculate the prescribed dose. Then available dose has to be in the same unit. Because of the 70 kilos, you got to convert the prescribed. He said 10 microgram per kilo per minute. You got to convert it because of the 10. And the available dose is in 400 milligram converted to microgram. And then when you finish, everything has to be converted in minutes. And that will give you 26. So the right answer is 26. Stop the video, watch the way I approach it. And next time when you see the question, approach it the same way. And this is the way I did it. It's the same thing. Which fetal position documentation by the nurse is representative of the image? You see this and say, oh, mommy has to deliver this baby. But how would I calculate it? Which position? You have to know the position of the baby and what you need to do. What do you think? Is this left occipital posterior, right occipital anterior, left occipital anterior, right occipital posterior? Which position is this? Pick your answer and let me know. But I can tell you what is the problem. Look at it. The best way is to look, mommy is facing you. So this is mommy left side, this is right. And the baby head is going to the right. So it has to be right answer. And the baby is using their back, occipitals. So right occipitals is touching where? Posterior, back of the mommy. So this is right occipital posterior. Therefore, this has to be the right answer. First, you have to know which way the baby is going, which portion of his head, and where is the baby touching. So that's your right answer. And let's administer insulin glycine to a client at 8 o'clock. At which time should the nurse most closely monitor the client for medication-related hypoglycemia? 9:30, 10:30, 12 o'clock, no specific time. Test-taking strategy. If you give the patient glycine, when should you check on them for make sure they don't have hypoglycemia? And that's what the question is asking. You ready? You pick your answer. What do you think? But I can tell you there's no specific time. Why? Glycine is long-acting. It has no peak. The peak time is when you will get hypoglycemia. Therefore, no specific time. If it's what? Fast-acting, then it will be 9:30 because it's what? 1 to 3 hours. So you had 1 to 3 hours, half an hour, 30 minutes, it will be 9:30. If it's just a regular insulin, it's usually 1 to 5 hours. So half, maybe 2, 3 hours, you had it, you get that. And if it's intermediate, it's 4 to 12 hours. So minimum 4 hours, right? And therefore, this is the way you calculate it. So pay attention with this kind of strategies, test-taking strategy. If you get this wrong, I know you got it, but it's just paying attention to the fact that we're dealing with the glycine. And let's prepare to admit a 4-year-old client with this rash and sore throat from the emergency room. Which two action by the nurse is consistent with the disease? Select or apply. Client wear N95 on the airway. Nurse perform routine care with no mask. Client in this semi-private room. Nurse employ single-use equipment. Nurse perform hand hygiene with soap and water. Nurse wear gown, gloves, surgical mask for routine care. This is a what? Infectious control, infection prevention. And you click on it, and this is what you see. This is the rash on the kid face. What do you think? First, make a diagnosis. Ask yourself, what condition is this? And based on the condition, what infection control protocol should you institute? That's all. They said pick 2. Therefore, you cannot pick more than 2 here. I intentionally limit you because if you overselect, you get it wrong. But just pick 2. What is the diagnosis? And what do you want to do? Based on the diagnosis, you can figure it out. You pick your answer? I can tell you, this is what? Pavlo B19, right? Problem. Slap cheek rash. Pavlo B. If you see the rash, usually it's what? Droplet. But the presence of rash will turn it into standard precaution. If there's no rash and you know based on patient symptoms, it's Pavlo B19, they get a droplet precaution or the immunocompromised. This patient has rash now. Now it's what? Non-infectious. It's a standard precaution. Therefore, the nurse client does not wear N95. It's not needed. The nurse perform routine care with no mask, no need to wear droplet precaution surgical mask. Client can be placed in semi-private between 2 other patients. Nurse employs single use. It's not a contact precaution. Nurse perform hand hygiene with soap and water. It's not contact precaution. Nurse wear gown, gloves, and surgical mask. Is not what? Droplet and contact precaution. This is now a standard precaution. And nurse is care for a client who require assistance with hygiene care. Which of the following action by the nurse demonstrate clients maintaining the client dignity and privacy? 2026 NCLEX plan, test plan. This is one of them. You have to know how to answer question. Client dignity and privacy. Look at it. Make sure the sentence is describing dignity and privacy. Closing the door and covering the client with bath blanket during care. Leaving the curtain partially open to allow quick access if needed. Exposing only the area being cleaned while other areas remain covered. Asking the client if they prefer a caregiver of the same gender. Which of these tells you that we are maintaining client dignity and privacy? That's all. What do you think? You pick your answer? I can tell you, just expose the area that you work in and don't expose everything. All these answers and routine care will do, but it does not reflect client dignity and privacy. If you're doing just cleaning the leg, why do you have to expose the whole body? So clean the areas you want and expose them, but not everything need to be exposed. 20 question. And then caring for a client with acute respiratory distress syndrome who is on mechanical ventilator. There's a high pressure is sounding. What is the nurse priority? You hear high pressure alarm on a ventilator. What do you think? You know the concept. We saw a question similar to that. Increase the tidal volume on the ventilator, suction the client endotracheal tube, administer albuterol treatment, check the ventilator tubing for disconnection. You know, high pressure alarm. What causes high pressure alarm? Use that to answer the question. You pick your answer. I know you pick the right thing because it may be obstruction, suction the patient because high pressure alarm may be obstruction. Disconnection may be leading to what? Low pressure alarm. Albuterol has nothing to do with high pressure alarm. First, you got to find the problem, assess them. Increasing tidal volume will cause pneumothorax and it increases more high pressure alarm. So B is your right answer. And this is positioning a client who is at risk for what? Sacral decube in the right sim position. You have to know right sim position. Positioning, key, safety. Which of the following positions should the nurse place the client's left arm? Patient is most likely to get sacral decube. You put them in the same position. But what do you do with their extremities, the right arm, because the left arm? Because it's very important. You got to prevent injury to that. Watch the patient, watch the positioning of sim, and look at what your left hand is going to be. You can use it to answer the question. Flex at the shoulder and elbow and place it on the pillow. Position behind the client head. support on the pillow at chest level, extend straight downward along the client sides, place under the client body. Very, very important positioning that will provide safety to the patient. You pick your answer. This is a little bit difficult, but you got to imagine same position. I can tell you A and C are the right answer. You have to flex at the shoulder. That's where you place it, and the elbow. This support the patient and in neutral position. You position behind the client back. No, that's you breaking the hand. You support at the pillow at the chest level too. Extend straight downward. No, it will cause contraction. And place on the client body. No, they can't lay on it. And this is the explanation for all of them. Next generation NCLEX. This is a bow tie question. 27-year-old woman delivered vaginally 48 hours ago. She reported foul-smelling vaginal discharge and heavy bleeding. I deliver, now I'm having foul-smelling discharge 48 hours, and I'm bleeding at the same time. Two things, foul-smelling and bleeding. Usually they don't care at the same time, but something has to happen for this to occur. She's changing pad every hour. Then there's pain and chills. So there's infection and there's bleeding. So you got to take care of it. We have what? Temperature 101, tachycardia, and this all consistent with what we're talking about. The fundus is firm and located below the umbilicus. So it's contracting. Which of the following is the most likely condition the patient is suffering? Do you think this is what? Atony, placenta, fragment retention, endometriosis, or vaginal hematoma? What do you think? And if that's, do you apply highs to the perineum, massage the uterus firmly, administer IV antibiotic, obtain blood culture, or then you monitor decrease in size of the uterus, temperature, lochia quantity, and vaginal. Therefore, this is the question. Which one do you think? I can tell you this is endometritis. Why? Uterine atony, the uterus will not be contracted, therefore eliminated. Placenta, retain placenta fragment, it will prevent the uterus to be completely contracted. At the same time, you're not going to have fever. And the vaginal hematoma, usually you're going to have just perineal pain, there's no fever. Therefore, this is endometritis. That's what is causing the problem. If that's the problem, then what are we going to do? Apply highs, massage the uterus, antibiotic, and blood culture. We know this is an infection. We have this and that. Everything was said here. Patient has heavy bleeding and foul-smelling discharge. That will tell you, I got to give them antibiotic and obtain blood culture. And then what? What are you going to monitor? If you have infection, temperature. And then what is the problem? Lochia. It has nothing to do with the uterine size. It's already small. And there's no vaginal necrosis. It's when you have hematoma in the pelvis. But this is what you see. NCLEX practice question. Questions and answers. Next generation, bow tie question. How did you do? I know you mastered it. And this is caring for a client diagnosed with pneumonia. Prioritize the following nursing intervention in order of importance. If you're taking care of a patient who has pneumonia, how would you take care of them? Give them antibiotic, encourage deep breathing, monitor the oxygen saturation, position them in the high floor, and obtain sputum for culture and sensitivity. This is the 2026 NCLEX questions in order to help you, because this is the way prioritization in a different form. So arrange this in the order that you think is appropriate. You ready? Yes, we got to position them. That's much better. And then we got to monitor the oxygen saturation. We're going to obtain sputum culture. And then we give them antibiotic and encourage deep breathing. This is the way you manage a patient who has what? Pneumonia. 24. And then she's caring for a 4 client diagnosed with pneumothorax. There's different kind of pneumothorax. Some of them may be okay, some of them are not. Which clients require immediate intervention? That means something bad is happening. Client, he has chest tube in place. But what do you see? Gentle bubbling in the suction chamber. Is that expected finding? Client reporting mild chest pain. Then he has shortness of breath with saturation 95. Client at what? Tracheal deviation on the right, respiratory rate of 42. There's absent breath sound on the left. And if you have chest tube and you see this, it's okay. Client with subcutaneous emphysema, mild swelling, around the chest tube insertion. What do you think? Risk reduction. Which one require intervention? I can tell you, tracheal deviation, that's what? Tension pneumothorax. That's bad. Subcutaneous emphysema, expected finding when you put chest tube in. Patient asthma, chest shortness of breath, saturation is 95. And then continuous bubbling in the suction chamber, expected finding. And this is caring for 4 pediatric clients with asthma. You can have a bunch of asthma patients, but who is in trouble? Which client require immediate intervention? 10-year-old, accessory muscle use, oxygen saturation 92. That's asthma. 7-year-old has an asthma. You hear wheezing, respiratory rate of 34. He's speaking what? Short phrases. Can't complete the sentence. 9-year-old suddenly become quiet. Asthma patient getting quiet. Now he has what? Respiratory rate of 28 and a diminished breath sound. 8-year-old, you get albuterol 30 minutes ago, and now heart rate is what? 118. What do you think? Who is in trouble? Who you want to see first? Who you want to intervene because they're having problem? This is risk reduction. You ready? Silence chest. 9-year-old suddenly become quiet, and asthma patient is in trouble. That's silent chest. That patient is in trouble. Accessory muscle, audible wheezing, tachycardia after albuterol, it's okay. They are not great. We can monitor you. But this one, silent chest, patient is tired, respiratory acidosis, is dying. And this is caring for a client who is 1 day post-operative following cholecystectomy. The provider prescribed clear liquid dye. Which of the following meal is appropriate for the nurse to offer? What is clear liquid dye? That is the concept to answer the question. Don't overthink it. Chicken broth, apple juice, gelatin, number 1. Cream of mushroom soup, milk and pudding. Scrambled eggs, toast, orange juice. Oatmeal, banana, and herbal tea. Which of this do you think consistent with clear liquid dye? I'll give you a clue. See-through. See-through. That's your buzzword. You pick your answer? You pick your answer. The right answer is A. Chicken broth, see-through. Apple juice, see-through. Gelatin is jello, see-through. Milk, you cannot see through. I just pick the wrong in between them. Scrambled egg is a regular food. Tea is fine, but banana, oatmeal are regular food. And this is assessing a client who has major depressive disorder. Which of the following findings should the nurse suspect? Select or apply. This is my favorite question. Anhedonia, apathy, agitation, alongia, anorexia, agnosia. I love this question because this is a bunch of trap. It's easy to over-select, but pick those that you're confident. You have to know the meaning of them. Stop the video, pick your answer. Question 27. Put it in the comment and let me know what you think. And I want to know where you're watching from. Wherever you're watching, put it in the comment and say, I'm watching from here, with whichever continent you are. But thank you for watching. Thank you for sticking around. 27. What is your score? Put it down. And question 27. But I can tell you, anhedonia, lack of pressure, you see in depression. Apathy, what? Interest. I don't care. Lack of motivation. Apathy, lack of motivation. Anhedonia, pleasure, you don't have pleasure, interest in doing anything. They may have psychomotor agitation. So this is it. Alongia is a trap. It's a poverty of speech. You see it in what? Schizophrenia. Anorexia, yeah, they will eat or they not eat. You see it in depression. Agnosia is about seeing people face objects and you can't recognize it. Alzheimer's disease, neurological problem. Therefore, watch for that. Anhedonia, apathy, agitation, anorexia, consistent with depression. The rest are not. And this is assessing a client's abdomen following exploratory laparotomy. Which of the following action should the nurse perform last? Right? Skills, management. Palpitation, auscultation, inspection, and percussion. When you examine the abdomen, what is the last thing you do? Pick your answer, let me know. Of course, you can come and just push on the abdomen, it affects your bowel sound. So at least you got to look, you got to listen, And then you got to percuss before you palpate. A medical surgical nurse is floated to cardiac unit, floating nurse assignment. Which client is most appropriate for the nurse to care for? Client admitted with acute myocardial infarction receiving nitroglycerin infusion. Client with heart failure who requires daily weight and oral medication. Client 2 hours post-cardiac catheterization with the frank ecchymosis. Client with a new onset atrial fibrillation receiving IV detizer. Which one is okay? To give it to a floater who went to the cardiac unit. I'll give you a clue. Give them patient who's stable, does not require a lot of extensive work, or you can assign them whatever nurse can do, they can do. You pick an answer? I know you picked the right answer because the right answer is what? B. Heart failure. All you need is some medication, oral medication. Everybody nurse can do that. IV nitroglycerin infusion. Bad. A bunch of information. Cardiac catheterization. A. Frank ecchymosis. This patient is bleeding. Atrial fibrillation. IV detizer. Problem. That one is easy for them. Another ICP question for the 2026 NCLEX test plan. And this is caring for a client who has ICP intracranial pressure monitoring in place. The nurse is working with assisted personnel. This is delegation, a changing in the form of delegation. Which of the following tasks should the nurse delegate to the UAP? Assess the ICP waveform, reposition the client head to midline, zero the ICP transducer, and interpret the ICU reading. What can the UAP do? Delegation question, management of care on ICP monitoring. 2026 test plan question. What do you think? Of course, UAP, anything that does not require thinking, and ADL, reposition is the best thing for them. They don't access, they don't touch the ICP monitor, and they don't interpret it either. And then in the emergency department is caring for a client with what? Hyperosmolar, hyperglycemic state. After initiating IV fluid, which prescription should the nurse implement first? Give them IV insulin, administer glucose supplement, obtain serum potassium level, initiate cardiac monitoring. This is a critical thinking question. If you mix it, it's okay. I will tell you why, what mistake you make. So next time you don't do that. But stop the video, pick your answer. Question 31. Let me know what you select. It's critical thinking. You pick your answer? I can tell you the right answer is that. Potassium. Why? Let me break it down for you. First, go to what? HHS. HHS is like what? DKA. Same thing. They come in dehydrated. They are hyperglycemia. You got to monitor them. You got to start with fluid. After you give them fluid, before you give them insulin. So fluid first, then insulin. But whenever you're going to give a patient insulin, you got to make sure their potassium is what? Normal. You got to make sure their potassium is normal. Because if you give them insulin and you don't check the potassium, they become what? Hypokalemic. And that's a big problem. Fine, we're going to give you insulin, but I got to check your potassium, right? You don't give them glucose right now. And then you have to know what their potassium is before you can monitor you can place them on a cardiac monitor. So number 3 is a right answer, but if you get it wrong, it's okay. We got you. And nurse is caring for a client who has ICP monitor in place. Which of the following actions by the nurse indicate correct care for ICP monitoring system? Another 2026 NCLEX question that you may see on ICP monitoring. Level the transducer at the phlebiostatics axis. Zero the transducer at the level of the tragus. Disconnect the tubing to reposition the client. Flush the system repeatedly to maintain patency. Zero the transducer at the level of the tragus. That's the best one. Phlebiostat axis deal with arterial A line. Do not disconnect the tubing to reposition the client. There's no reflushing regularly to maintain patency. Once a while is prescribed. Therefore, B is the right answer. These are all things I think you should know in order to help you answer questions on the ICP. And this is caring for a client who has measles, rubiola. Which of the following transmission-based precaution should the nurse implement to provide routine care? Measles, rubiola, what do you think? Put them in the category. Is it airborne, droplet, contact? And then pick your answer. Gown and gloves, gown and face shield, perform hand hygiene with soap and water, place the client in a negative pressure room, require use of N95 respirator. You pick your answer? You pick your answer. I can tell you, rubiola is airborne. If it's airborne, you don't need to wear gown and gloves. Number one, straightforward, right? You don't need gown and face shield for airborne. What do you think? You don't need to perform hand hygiene with soap and water. You do it for what? Contact precaution, because you have an option to do what? Do what? Hand sanitizer. You place the client in a negative pressure room and require N95 because it's airborne. That's infectious control question. And this is performing home safety assessment for an other client. What is that? Safety question. Which of the following findings should the nurse identify as safety hazard? Select or apply. If you go to somebody, older patient room, house, and you see what? Throw rags placed throughout the home, grab bar installed in the bathroom, extension cord running across the walkway, adequate lighting in hallway, clutter on the floor near furniture, and frequently used items stored on high shelves. Which one should worry you? Which one you think is a safety hazard? Pick your answer. You say yes or no. That's all. You ready? Throw rags, stop the video, pick your answer on your own before I show you the answers. I know you pick it. But throw rags throughout the house, it's a safety hazard. That's bad. Grab bar installed in the bathroom, no, it's not safety hazard. It's protecting you, therefore it's not. Extension cord running across the walkway, safety hazard. You're going to trip. There's lightning in the eye, always, that's a good thing. It's not a safety hazard. If you have clutter on the floor near the furniture, bad problem. You're going to fall. And frequently used items is stored on the higher shelves, while trying to reach it, you fall down. Therefore, safety hazard. And this is caring for a client who has history of seizure. Patient has history of seizure. Another safety question. The client has just experienced a seizure episode. Which of the following actions should the nurse take after the seizure? Select or apply. Pay attention. The buzzword is after seizure. Not before, not during, it's after. When you answer this kind of safety question, keywords matter. And therefore, after seizure, what do? Apply padded sided rails to the bed. Identify potential seizure triggers, insert a tongue blade to prevent airway obstruction, place the client in the side laying position, document the duration and the characteristics of the seizure, provide privacy during the post-ictal phase. Pick your answer, stop the video, keep track of your answer, and thank you for reaching question 35. You pick your answer? I can tell you, you don't need to apply padded rails to the bed. It's before they have seizure. Identify triggers before they have seizures. Insert tongue blade to prevent airway obstruction. You never use it. Bad thing. Place the client in the side lane after seizure to prevent what? Aspiration. Document the duration and the characteristics of the seizure so that we can know what kind of seizure. Is it grand mal seizure? Is it tonic-clonic? Is it absent seizure? All of them, very important. There's no privacy after you have seizure. We got to stay with you. We got to orient you. We got to protect your airway. Therefore, F is a trap. Don't pick it. Which topic should the nurse include when providing anticipatory guidelines for later pregnancy? Select or apply. If you're teaching mother about pregnancy, what are the things you got to help them with? Breastfeeding education, childbirth preparation class, postpartum mood changes, safe sleep practice for the newborn, toilet training techniques, periodontal disease prevention. Which one you think you should include in what? Prenatal care teaching for the mother. That's all. This is health promotion. Stop, select or apply. You can see I loaded this question with a bunch of select or apply. And I know you make ace in them because you know how to do them. Don't over-select. Pick those that you're 100% confident. Number 36. Of course, they need to know how to teach breastfeed. They have to know about childbearing preparation class. They need to know about postpartum. When you're a baby, there's likely there will be mood changes. Sleeps of the baby practice that is safe. Toilet training is too late. It's too early. We don't worry about it. And periodontal disease get worse when you get pregnant. Therefore, we got to know about. Another next generation question. 3-hour-old new infant, this newborn case study. The baby was delivered via what? Vaginal delivery at 39 weeks gestation to 30-year-old mother. So 3 hours, just born. The pregnancy was uncomplicated. Nothing happened. The baby mother presented with what? Prospitus labor. That's why it's 3 hours. Within a short time, the baby delivered and did not receive what? Antibiotic. GBS status is unknown. We don't know whether she had GBS positive or not. So baby may have sepsis at the time of delivery. Amniotic fluid was clear. Okay, AVGA score 8 at 1 minute. That's good. And then 9, what is the problem? At 5 minutes. The birth of the baby, 3.4 kilos. Not bad. There's no resuscitation required because the baby was fine. But what is the problem? An assessment, there's grunting, nasoflaring, there's subcostal retraction. Baby is not doing well now. Respiratory rate, 76, higher than normal, 30 to 60. Temperature, going up. Oxygen saturation, 89. Room air, we don't like it. Baby is lethargy, poor feeding. Something is happening. Think about the GPS causing the problem. This may be a problem. Which finding are concerning? Select or apply. Look at the case again. If you think it's worrisome, I read it in such a way to guide you to the areas that you should pick. Read it again, pay attention to the buzzword, and see which one is concerning for you. But I don't like the respiratory rate of 78. It's bad. AVGA score of 8 and 9 is good. There's nothing to worry about it. Temperature, I don't like it. The baby temperature, I don't like it. It's abnormal. Baby has poor feeding effort, and his oxygen saturation is not good. What is the next priority action? Place the baby under radiant warmer. Notify the air care provider for workup for sepsis. Encourage breastfeeding. Reassess in 30 minutes. Remember, GBS, all of these signs and symptoms should be concerning to you. Therefore, what should we want? Reassessing in 30 minutes. Baby is not doing well. It's grunting. That's respiratory problem. It's not feeding well. We got to work the baby out for sepsis from GBS. Place the provider order in the correct sequence. What we order some order. The provider said, oh, drop rock culture, CBC, and CRP for infection. Start IV ampicillin and gentamicin, that's antibiotic. Maintain the kid MPO so that they don't eat anything, and monitor their temperature every 2 hours. That means we worry about sepsis. What would you do? How will you arrange this? Based on the order they're giving, which one you want to do first? That's all. What do you think? Of course, we got to draw blood culture. And as we draw in blood culture, we place the IV in place. We start the antibiotic. We monitor the temperature. No, we make the kid MPO and we monitor the temperature. So draw your blood culture, place the IV after you draw the blood culture, start the IV antibiotic, maintain the kid MPO and monitor the temperature. Which lab would the nurse expect to be elevated in a client? If we think this is sepsis, which one? CRP, ESR, platelet, WBC, RBC. Which one will be elevated? What do you think? CRP, signs of infection. ESR, signs of infection. You have to know them. And D, WBC, signs of infection. Mostly when you have infection, platelet may go down. And your RBC, nothing will happen to them. What teaching point should the nurse prioritize when speaking to the parents? Now they have baby has group B sepsis. Importance of AVGA score, explaining of phototherapy, signs of respiratory distress, and need for what? Close monitoring, breastfeeding position. You know what the kid have. What do you think you want to discuss? The Africa score was fine. Baby is not jaundice, therefore sepsis. Breastfeeding position is irrelevant at this time. For each of the following nursing action, indicate whether it is what? Priority action. Should we institute as a priority, or this is a supportive care, or require provider notification, or not recommended? So, what do you think? Initiate continuous pulse source. Is that okay? Encourage breastfeeding. Notify the provider of the respiratory status. Reposition the infant. What do you think? So which one you think it require supportive care, recommended, priority, and require intervention? Continuous pulse source, this is a priority thing we should follow. Breastfeeding right now is not recommended. Notify the provider about the respiratory status, yes. And when you reposition a client, it's a supportive care. So this is just a way to trap you to overthink, just basically a fancy way the NCLEX will do that to you. And this is the next generation question. This is the way you answer this kind of question. How did you do? I know you ace it. Which findings should the nurse instruct the pregnant client to report immediately? Patient is pregnant, maternity question, head promotion, select or apply, 1 pound weight gain per week, right? Persistent severe headache, sudden swelling of the face and hand, nausea in the morning, and more than 12 kicks in 2 hours. If you have a pregnant patient, you're providing head promotion and maintenance, and you tell them maternity patient, which one should you let them call you right away? What do you think? 1 pound weight gain is okay. You don't need to call me. Persistent headache, I don't like it. You should call me. Preeclampsia. Sudden swelling of your face and hand, I need you to call me because that may be preeclampsia. Nausea in the morning may be expected. 12 kicks, baby is doing great. A client with a documented egg allergy is scheduled to receive influenza vaccine, which action by the nurse is most appropriate. This is very controversial. That's why there's questions. You have to know that when they ask you, you stick with what is recommended. I have allergy to what? Egg, and I'm going to get vaccine, influenza. Should I get it or not? Withhold the vaccine and notify the healthcare provider. Administer the vaccination and monitor the client for adverse reaction. Cancel the vaccination, reschedule with an allergist present. Substitute the influenza vaccine with another vaccine, immunization. This you have to know because it's very common to be asked about allergy in the patient who's getting what? Influenza and they have egg allergy. I can tell you, just because you have egg allergy, there's no contraindication. It means after we give you, we have to monitor you. That's all for reaction. But it doesn't mean we should withhold it. It doesn't mean we should substitute it. It doesn't mean we should stop it. Next time you see it, apply that knowledge. There's no contraindication. And as assessing a newborn delivered at 39 weeks, right? Which finding require immediate intervention? Bad problem. Acral cyanosis of the hand and feet. Presence of moral reflex. Respiratory rate of 72. Blood glucose of 35. Which one? Immediate intervention. Risk reduction. What do you think? Number 40. I can tell you, his blood glucose is too low. Respiratory rate 30 to 60, but hypoglycemia is more dangerous than respiratory rate 72. So that one, we got to figure out, is the baby symptomatic or not? Then we can figure it out. But A and B are expected finding. A nurse is caring for 4 clients who is receiving different medication. Which of the following client is at greatest risk of experiencing sudden syncope due to the cardiac dysrhythmia? Let me read it again. Pay attention to it. There's a bunch of words. Read it from back. Which of the following client is at greatest risk for experiencing sudden syncope due to what? Cardiac dysrhythmia. A nurse is caring for 4 clients who is receiving what? Different medication. I'm on risperidone, citalopram, bupropion, metafenidate, pharmacology, psych pharmacology, critical thinking, psych pharmacology. Which one do you think? You pick your answer? I can tell you, the citalopram is the right answer. Pay attention to it. The question says syncope. Why do you have syncope? Because there's a cardiac dysrhythmia. That means this medication has to affect your EKG, cardiac. The only thing that causes QT prolongation and it causes syncope is citalopram. Risperidone causes orthostatic hypotension, and that can make you fall too. But it has nothing to do with your EKG. Propion, metafenate don't do that. Citalopram affect EKG. Therefore, this question is asking about cardiac dysrhythmia. That's why it's not risperidone. It causes hypotension, orthostatic hypotension, and you may fall. But citalopram is the most important. Critical thinking. And as you care for a client who is receiving chemotherapy and has severe stomatitis, right? Oral mucositis. This is also pharmacology therapy question. Which of the following teachings should the nurse include? If somebody is getting chemotherapy and they have mouth sore, that's what you call it, severe stomatitis, oral mucositis, what teaching should you provide? Use a soft Bristol toothbrush for oral care. Rinse the mouth with the salt water or baking soda solution. Increase intake of spicy, acidic, and rough textured food. Use alcohol-based mouthwash daily. Increase intake of citric juice. And use topical oral anesthetic as prescribed before meal. What do you think? You don't have to pick everything. Once again, I keep on emphasizing, select those that you're 100% confident. If you have mouth sore, what would you do? Well, soft Bristol toothbrush so that you don't bleed. You rinse your mouth, soap and water to help with that. Salt and water to help with that. Spicy food, acidic will burn you. You couldn't use it. Alcohol mouthwash will burn you. Don't use it. Increased intake of citric food will burn you. And then you can just use topical as prescribed before meal. Just apply it as required. That's all. This is the way you answer this kind of question. And this is caring for a client who was admitted 72 hours and has a history of chronic alcohol use. Which of the following clinical manifestation the nurse should expect with delirium tremor, which happen after 48, 72 hours? But what do you see in delirium tremor? Hypertension, visual hallucination, bradycardia, decreased level of consciousness, increased parasympathetic activity, hysteresis. What do you think? If you have delirium tremor, what do you expect? Stop, pick your answer, and let me know. Pause the video, pick your answer. You pick your answer. Remember, alcohol withdrawal is a downer. If you're withdrawing, you become upper. Therefore, pick your answer. Let me know. DT, when it's happening, what is going to, you have autonomic dysfunction. And therefore, they're going to be hypertensive. And they may have formication, which is what? Visual hallucination. They're going to be tachycardia, no bradycardia. Their level of consciousness will go up because they are agitated, they're confused, they usually alert. Therefore, it's not decreasing. That's a trap. If you pick D, it's a trap. I trap you. Their sympathetic nervous system up, no parasympathetic. Hysteresis is associated with the liver disease. So A and B are your right answer. And this is caring for a client who switched from what? Sertraline to Phenytoin due to what? Weight gain. Pharmacology, psych medication. From what? Sertraline to Phenytoin. Which of the following dietary teachings should the nurse advise the client to avoid? Select or apply. That means you should stay away from it. Smoked fish, curry meat, white wine, cheddar cheese, ricotta, cottage cheese. If you take in sertraline, they stop it. They say you can take Phenytoin. What teaching do you teach them they should avoid in terms of diet? What do you think? Pick your answer, let me know. But I can tell you, the patient moved from SSRI to MOI. MOI, you should avoid tyramine food. Which of these has a bunch of tyramine? That's all. And if he has a tyramine food, you should stay away from it. Smoke, anything that is smoke, fish, meat, whatever. And if it's curried, stay away from it. White wine is good. Red wine is bad. Cheddar cheese is what? Aged. But ricotta and cottage cheese are not aged. They're fresh. Therefore, you can eat ricotta cheese, cottage cheese, but cheddar cheese, you cannot eat it. And that's you should avoid because it's MOI. And nurse is caring for a client who has a chest tube in place for pneumothorax. During assessment, the nurse note absence of tidling. If you don't see tidling, what do? Which area of the chest tube system should the nurse assess to confirm it? Where do you look on the chest tube to see if tidling is occurring? Collecting chamber, water seal chamber, suction control chamber, tubing connecting port. Where do you look for what? Where do you look for tidling? Absence. If there's no tidling, look at the water seal chamber. You see the water go up and down. That is the best place. Collecting chamber, you see water, suction control chamber, and tubing connecting to the suction, you don't see it. So that's the place. And nurse is caring for what? 4 clients on a medical surgical unit. Which client should the nurse assess first? Who is in trouble? COPD, who has shortness of breath after walking and has oxygen saturation 89 on 2 liters. Okay. Client with pneumonia who is reporting sharp chest pain with deep inspiration. Okay. Post-op appendectomy with the blood pressure of 88/56 and a no complaint of pain. Okay. A client with the new onset of diabetes asking how to use an insulin pen. Who is in trouble? Who? This person is in shock. Even though he has no complaint of pain, blood pressure is too low. We got to worry about it. D, we got to provide teaching. Pneumonia, you're going to have chest pain when you take breath. COPD, when you walk, you're going to have shortness of breath. Saturation 89 on 2 liters, you're doing okay. Nothing to worry about. And nurse is caring for a client at 37-week gestation. Assessment revealed right occipital posterior fetal position. You know, the right occipital baby head is going to the mommy on the right side, right? And the head is pushing on the back, posterior. The nurse will listen for point of what? Maximum intensity of fetal heart tone in which position? Above the umbilicus to the client's left side towards the back of the pelvis, above umbilicus to the client's right side towards the back of the pelvis, below the umbilicus towards the right side towards the back of the pelvis, below the umbilicus to the client's left side towards the back of the pelvis. They sound the same. Ignore it. When you see questions like that, strategy, ignore the answers, go and figure it out yourself. That's all. Then come back and put the answer down. So pick your answer. I will show you how to approach it. You pick your answer. They say what? Right occipital posterior fetal position. That means the baby is not breech. It's in the right position. So if this is the pelvis, the umbilicus is here, the baby at least head is down towards the right side. Therefore, it's not breech. If you breech, you're sitting up. Your head is above the umbilicus. Therefore, I know baby head is below the umbilicus. Just by that, this is gone already. Now I see what? This is also gone. You say above. Now I have C and D. You see, this is the way you break the questions. Then you can figure out the answers. Below the umbilicus. But I know baby is going to the right side. So I will listen towards the right side of the back. And that's all. You figure it out. Is that hard? I know you watch Adaptation. Next time when you see it, you will know it. Right posterior, occipital posterior is the vectors, with the baby occipital touching the posterior aspect of the mother on the right. Vectors heart tone are below the umbilicus. And nurse is caring for 4 clients in a substance abuse unit. Which client are highest risk for dangerous withdrawal and require priority intervention? A client withdrawing from morphine, a client withdrawal from cocaine, a client withdrawal from methamphetamine, a client withdrawal from benzodiazepine. Which kind of withdrawal is more dangerous that will cause more problem? What do you think? I can tell you, downer withdrawal are more dangerous. Downer, right? Morphine is a downer, good. Cocaine is a downer, good, is a upper, good. Methamphetamine is a downer. So they will be gone. B and C is gone. Now you have morphine and alcohol. Now you have morphine and benzos. Therefore, which one? Benzos withdrawal cause seizures. Therefore, that's more dangerous. This one is bad. A female client is scheduled for laparoscopic cholecystectomy. During the pre-op assessment, the nurse reported that she stopped taking a oral contraception 1 week ago as prescribed. Which of the following is the most critical nursing intervention based on information? During assessment, this preoperative assessment, you assess the patient, the patient take oral contraception, stop the medication, right? 1 week ago. What do you think? Instruct the client to resume taking the oral contraception after surgery. Assess the client for signs and symptoms of pregnancy. Document the client medication history in the medical record. Inform the surgeon about the client's recent discontinuation of the oral contraception. This is a trap. Health promotion, very important. But he has perioperative complication issue. Which one would you pick? Stop the video. Pick your answer. Think about the effect of oral contraception on surgeon. You pick it. D is the right answer. More likely to get DVT-PE. So I need to know. Acute discontinuation of contraception has very bad complication. You can get a PE or DVT. So the nurse should let the doctor know. I know you worry about pregnancy, but that's not the major problem. We will figure out later. But the major complication associated, most critical nursing intervention is not because you may be pregnant, but because you may have complication that may kill you in the surgery. Four school-age children are in the school office. Which client SBIT clicked on the SBIT for clinical data? Who need to go home? A, B, C, D. What is A? Intensely itchy rash with blisters shaped like a wristband. Flesh, painless, stuck on growth on the hands and feet. A slap cheek on the face. Intensely itchy pimple rash with boil on both hands. This is a description of infectious disease. You got to recognize each of them and then place them in the group, which with the kind of precaution you want to do. What do you think? What do you think? Slap cheek is a standard precaution, right? Intensely itchy, people like brow rash on the hand and feet. This is for scabies. Fleshly stark on, this is what, right? An intensely itchy rash with blisters shaped like a wristband, this is contact. Therefore, which case should go home? D should go home because he has scabies. Everybody's going to get sick. And nurse is caring for a client receiving what? IV furosemide for what? Heart failure. Which finding indicate the medication is effective? What is the medication going to do with heart failure? Increase blood pressure, increase urine output, reduce pulmonary crackles, and increase potassium level. If you take what? Furosemide for heart failure, what is it going to do? Pause the video. Let me know what you think. But I can tell you what we worry about, reduction in crackles, because it's decreasing fluid in your lung. It's not going to increase your blood pressure. It's going to decrease it. It may increase your urine output, but it does not answer the question. It does not increase your potassium. It decreases it. A nurse is caring for a client who has a chest tube in place for pneumothorax. During assessment, the nurse notes absence of tidally in the water seal chamber. Which of the following conditions should the nurse suspect? The same question, I changed the answers so that you can master them. There is no tidally. Now we're not looking at the location. We look at the water seal chamber area, but no. What does that mean if there's no tidally? What should you worry about as a nurse? Persistent hair leak, lung expansion, absence of kink in the chest tube, normal inspiration, expiration. When you see no tidally, what action should you take? That's all. You pick your answer. Absence of tidally means there is a kink or the lung is expanded. That means there's no problem with the lung anymore. This is absence of kink. No, there should be a kink. If the lung is expanded, that means you're not going to have tidally. If you place the chest tube for pneumothorax, normal inspiration, expiration, no, it will show what? What do you think? It will show tidally. And the persistent hair leak has nothing to do with tidally. An off-going nurse administer morphine to several clients. During on-off, the ongoing nurse review the assignment. Which of the following client has higher risk for respiratory depression? Select or apply. So I'm going, I give morphine to a bunch of patients, and you come in. Who should you worry about may going to have respiratory compromise? A client who is opioid naive, that means never had opioid before. A client whose BMI is 40, obesity. Client who take diphenhydramine for sleep. Client who has COPD. A client who has PAD, peripheral arterial disease, who is going to have respiratory depression based on their condition after you give them morphine. Pick your answer. Let me know. Don't overselect. Select or apply. I can tell you the right answer. If never taken opioid before, it makes you sleepy. So you may have respiratory depression. Obesity, they may have hypoventilation. If you take diphenhydramine, it's a dino. It depresses your central nervous system too. COPD patient, problem. OSA patient, problem. It has nothing to do with PAD. A client with a heart failure is receiving furosemide, which assessment finding require immediate action by the nurse. Bad problem. Potassium 3.9, blood pressure 118/72, urine output 2000 ml per day, sodium of 135, and then ringing in your ear. You're getting furosemide, loop diuretic. Which of these should you worry about? You got to intervene. Risk reduction. Pick your answer. Let me know. Don't overselect. Don't pick an answer because it says something. Make sure it's the correct answer. But I can tell you, potassium 3.9 is normal. Why do you pick it? Blood pressure is still normal. Why do you pick it? Urine output. I expect your urine output to go up. Don't pick it. Sodium, still normal. Don't pick it. Ringing in the ear is bad. We got to slow down the IV infusion. Next generation NCLEX. 72-year-old male brought into the emergency room by the EMS after the wife reports what? Slurred speech, number one. Right-sided paralysis. The body is paralyzed. And he said, I grabbed his head like he had the worst headache of his life. Worst headache of your life. What kind of headache is that? Symptoms began 25 minutes ago. Is he bleeding? Long-standing hypertension because he has hypertension, poorly controlled. He has AFib. He stopped taking his medication a month ago. He has hyperlipidemia. Look at his blood pressure, very high, irregular, AFib, right? He has slurred speech, right-sided facial droop, hemiparesis, GCS of 40. He grabbed the left side of his head. He said, my head is exploding. What do you think? High blood pressure, head is exploding, have signs of stroke. What is going on with this patient? The nurse has reviewed the clinical data. Which of the following findings are concerning? Select or apply. Which one do you think concerning? What do you think? History of hyperlipidemia, I'm not going to change it, but the presence of facial drooping, signs of stroke. Right-sided weakness, signs of stroke. Slurred speech, signs of stroke. Worst headache of your life, subarachnoid hemorrhage. Bad problem. Which condition is most likely client is experiencing? Embolic, ischemic stroke, TIA, hemorrhagic stroke. His blood pressure is too high. It cannot be embolic. Embolic is from AFib causing blockage. They don't bleed. Ischemic doesn't bleed, but this look like I'm bleeding. Hemorrhagic stroke. Which of the following order should the nurse anticipate? Select or apply. EEG, EKG, INR, CT of the head, lumbar puncture. If you bleed in your head, I don't know EEG. That's what seizures. I need EKG to make sure what? Is it this due to your AFib? I need the INR to make sure you have not taking anticoagulation, right? CT of the head with contrast. No, we do it without contrast. I don't need lumbar puncture. I need to get a CT first. EKG showed the reading below. Which of the following the nurse should prioritize? What kind of this? This is EKG. This is AFib. If this is AFib, what would you have prioritize? Coumadin, aspirin, diltiazem, Adaptation. What do you think? If that's AFib, what do you think? You should prioritize rate control, not anticoagulation. Adaptation will worsen the situation. Coumadin, all this will come later, but rate control is the best. The next day, the patient rhythm changes to what? This rhythm. What do you think? We have another rhythm. All of a sudden, we have this EKG. What do you think? Is this, how would the nurse interpret this? Is this worsening or improving? What do you think? This is improving. So we move from AFib to A-flutter. A-flutter means your atrium is getting better. The ventricular rate is a little bit better, but we are not fibrillating. We're getting more organized. AFib is chaotic. So this one is improving. The CT confirmed left intracerebral hemorrhage. That means bleeding in the head with slight midline shift, right? Which order should the nurse question? They are bleeding in their head. What do you think? Keep the systolic blood pressure less than 160. Start nicardipine infusion. Start IV monitor. Begin heparin infusion for AFib. Which one should you question? You bleed in your head. You don't need a heparin. The rest are acceptable. This is the next generation question. How did you do? I know you mastered it. EKG, you saw this already. And this is caring for a client on tele unit who report palpitation. The cardiac monitor displays this rhythm. Does it look familiar to you? Look at it again. You see this is, and you see this bunch of that. How would the nurse interpret this? Is this AFib, ventricular tachycardia, sinus tachycardia, atrial fibrillation? What do you think? Stop the video, analyze it carefully, and ask yourself, what is this? This is not atrial fibrillation because now this is regular. Ventricular tachycardia, this is, you have ventricular problem, which is normal, and we have atrial problem, which is abnormal. This is not sinus tach, this is atrial flutter. A client received 2 units of packed red blood cell. 30 minutes later, the client reports chills, fever, bad problem. What is the next priority action? Notify the healthcare provider. Stop the transfusion. Administer acetaminophen. Recheck the client vitals. What do you think? Risk reduction. Taking care of the patient, giving them transfusion, and they're reporting this. What do you think you should do? Stop the transfusion. A man who was physically abused as a child cannot recall the abuse. I was abused. I don't recall it anymore. Is it sublimation? Is it dissociation? Is it repression or regression? What have I done? This is repression. I don't want to remember it. Sublimation, I'm turning the bad stuff into good thing. Dissociation, I'm assuming another identity. Regression, I'm going back like a kid. So this is your right answer. And next care for assigned client. The nurse should first see which client. AFib on labetalol and cardiac monitor indicating irregular heart rate. Pericarditis with the blood pressure 140 over 115. Pneumonia with elevated WBC and crackles and lung base. COPD with palpitation after receiving Abodro. Who is in trouble? Which one? What do you think? This patient is in trouble. His pulse pressure is getting closer. That's a problem. You want at least more than 25, 30 pulse pressure. This patient is getting closer. He may be having cardiac tamponade. Labetalol, I give it to you for cardiac irregular heart rate is fine. Pneumonia with the white count and elevated crackles in the lung, that's okay. If you have COPD, palpitation when you receive Abodro, that's what Abodro does. That's your right answer. And then caring for a client in a tele-unit following myocardial infarction. During the morning assessment, the nurse observed a cardiac rhythm shown below. What should the nurse do first? What is this? What is this? I can tell you is what? Pick your answer. What would you do first? Notify the healthcare provider, start high quality CPR, immediate defibrillation, assess the client for a pulse. Pick your answer. What is this? And then pick your answer. What do you think? I can tell you this is a ventricular rhythm. Therefore, this is what? VTAC. It's uniform. It's not chaotic. If it's VTAC, I need to make sure I know whether it's pulseless or there's pulse. So check your pulse. You don't defibrillate until you know it's pulseless. You don't do CPR right now and then notify the healthcare provider. Still check the pulse before you can give them information. And this from the labor and delivery unit is floated to the medical surgical unit. Which of the following is the most appropriate assignment for the nurse? A client with the chest pain awaiting cardiac catheterization. A client 5-day post-cardiac cholecystectomy ready for discharge. A client with what? Type 2 diabetes who need assistance with ambulating and glucose monitoring. The client is sickle cell requiring IV opioid administration and close monitoring. Make sure you give it to the floater from the medical surgical unit, what she can see there and can take care of it. Who do you think? She's a labor delivery nurse. She's floated to the medical surgical unit. What do you think? This patient just needs glucose monitoring. Does not require too much. A close monitoring sickle cell patient, cholecystectomy discharge specific information, cardiac catheterization specific information. This patient is safe for them. And this is collecting data on the child who's been subjected to abuse. Which finding the nurse should expect or not expect when assessing the client? How would you know the kid is abused? Signs of abuse. Acting aloof, withdrawn, guarded, distrustful, difficulty with social interaction. What do you think? When you get a kid get abused, they acting aloof. They will be withdrawn. They will be guarded. They won't tell you anything. They won't trust anybody. And they will have dissociation problems, social interaction. This is all expected finding in the kid that is being abused. A charge nurse is making room assignment for a child post-appendectomy. Which room assignment is the most appropriate? Sickle cell patient, pertussis, concussion, diagnosed with asthma. Which assignment is appropriate for appendectomy? Make sure it does not get infected. Which one? Sickle cell patient crisis. There's a lot of things going on. They may be immunocompromised. Pertussis may affect the appendix guide. Asthma patient, client new diagnosed. We don't want any infection. Concoction patient is the best one. A nurse is caring for a client with medical surgical unit. Which of the following action by the nurse constitute negligence? That means you do something bad. Withholding a medication because the client refused. Does that mean negligence? Failing to put offside rails for a sedated client leading to a fall. Is that a negligence? Explaining the risks of the procedure before consent. Is that a negligence? Reporting unsafe staffing to the charge nurse. Are you negligent? Pick your answer, let me know. Ethics, mental health. But I can tell you, if you're supposed to do something by law and you forget, you don't do it, something happened to the patient is a problem. Patient fell because you forget to raise the bed rails. That's a problem. If you hold the medication because they refuse, you're obeying the autonomy. You explain the risks, you're doing your job. You're reporting something unsafe, you're reporting yourself. You're doing your job. And then she's assigning tax to LPN UAP. Which tax is most appropriate to LPN? MMR most. Monitor, reinforce after teaching, and special tests. Provide postmortem care, check intake and output, weigh the client, insert the Foley. Which one would you give to LPN? Postmortem care, both of them can do it, but mostly UAP. Intake and output, UAP. Weighing the client, UAP. Foley, LPN can do that. And this is caring for a client who became responsive following a large volume paracentesis. You remove fluid from the abdomen, mostly during paracentesis. Which of the following solutions should the nurse administer? Fluid and electrolyte problem, right? So normal saline, 3% normal saline, 25% albumin, lactate ringer. Which one is good when you have paracentesis and you are hypotensive? This is a TRAPI question, risk reduction question, very important, but it's a fluid and management question you have to know. After you remove fluid during paracentesis and the patient is sick, what fluid do you give them? You pick your answer, give them 25% albumin because you want on to something that will hold on to the fluid. Most people you do paracentesis, they have what? Low albumin. That's why they have ascites. If you give them fluid, you go back to the abdomen. You want to give them fluid that can stay in the intravascular system. Which one can stay in intravascular system? 25% albumin. The rest are crystalloid. The patient need colloid. And this is planning to Provide back rub for a client. Best care and comfort. Which of the following products should the nurse use? Talcum powder, alcohol-based lotion, moisturizing lotion, antiseptic lotion. Which one do you use for a back rub? You want something that is smooth, less friction, causing harm to the patient, moisturizing. All these things causes dry. Talc, alcohol, antiseptic will cause dryness. We don't want it. The client suddenly goes into cardiac arrest, and the nursing team initiates CPR. The team consists of RN, LPN, UAP, which task is appropriate for the LPN, select or apply. Assist with chest compression, administer prescribed IV epinephrine, attach and operate AED, document the event of the code, maintain airway with the bag mask and the RN supervision. Which one is okay for the what? LPN. You know what to do. Pay attention to the keyword. They can assist with chest compression. IV epinephrine in the code status, the nurse does that. Attach and operate AED done by the nurse or the one running the code. But they can document the code and they can maintain airway by the bag mask, so that's acceptable. A nurse is planning to perform a partial bath for a client. This is a strategy. This is a key concept. This is basic care and comfort. You have to know this bath. Sometimes it's tricky, but there's a strategy. Which of the following steps, place the following steps in the order the nurse should perform bath. So partial bath, how do you do it? Wash the client perineum, wash the client arms and hand, wash the client axilla, wash the client leg and feet, wash the client face, wash the client chest and abdomen. Arrange them in order. What do you think? You know, when you bath, the same strategy. Use it to answer the question. Pause the video, answer it. The first thing you do is wash your face. Then which one? So you start from the area that is clean. Your face is clean. Then you go to your axilla. It's much more cleaner than your hands before you wash your hands. Then you go to the chest, followed by their legs before their perineum. This is the way you wash doing partial bath for a client. And this is assessing a client pressure injury. The wound show partial thickness. There's partial thickness skin loss involving epidermis and epidermis. Only epidermis and epidermis. How should the nurse interpret this finding? Stage 1, 2, 3, and 4. It's about testing your pressure injury. Best care and comfort. Basic. 1 is just usually superficial. 2 is epidermis and dermis. 3 is deeper. 4, we are seeing bone. Therefore, this is 2. 2 more questions. How are you doing? What is your score? How did you do? NCLEX practice question. Most likely to be missed by most people because of the way the new test is coming. But this is a strategy. I put a lot of information here to master so that when you go, you don't worry. NCLEX practice test and question. Number 71. A client who recently diagnosed with cancer tells the nurse, I don't know how I'm going to handle this. Which the following response by the nurse is therapeutic. Everything will be okay. Try not to worry. You should focus on staying positive. Tell me more about what concern you must have. Many people go through this and do fine. Therapeutic communication, you know the strategy. When the patient says something, ask for more. Don't over-select. Let them talk. If you talking, it's a wrong answer. Therefore, tell me more about your concern. And the last question. Thank you for watching. Thank you for staying up to this. This is 72, but actually it's 85 question. I know your score was more than 65. And then a new graduate file an incident report due to client 4. Which component of the report need further teaching? Statement were in quotation mark, detailed explanation for the cause of the fall, name of the witnesses, intervention administered. This is a trap. It's always a trap. When you fill in incident report, there's specific things you should put in. It's what? It's an objective. There's nothing subjective. Don't explain yourself. This happened. This is what we did. this injury patient had. That's all. There's no explanation. Therefore, this is wrong answer. NCLEX practice question, NCLEX questions and answers, NCLEX practice test question review for the 2026 using key facts that you need to know. Likely, most students will mix, but when you know what to do, what to focus, you'll be mastering. Thank you. And if you'd like this video, check the next one. Test your knowledge. Another 65, you are golden to pass your NCLEX. Take care of yourself. Bye.